there is a tendency to take some of your work home with you. You think about things, you think about the outcome for patients and things like that. I think generally the Canadian healthcare system does a pretty good job. I mean, everyone always touts, free healthcare. We do pay for it indirectly with our taxes. Some of the main challenges, it would be congestion, it would be the relative lack of community resources and infrastructure, it would be the long wait list for referral to specialists or to have scheduled procedures or surgeries, progressing salaries with other healthcare professions, including physicians and also the nurse practitioners in relation to that new nursing contract was also a big step. And then I think the commitment from the government to create educational seats is also a very big key component. We just simply need, and I think that the more people become acquainted with the nurse practitioner role, I think a lot of nurses are becoming inspired to kind of pursue their education to that level. Nursing is a very humanistic profession, and it's not just reserved for females as caregivers, as mothers, or anything like that. Nurse practitioners are independent primary care providers, as are physicians.
Hello, my name is Sarush, and welcome to another episode of Beyond the Scrubs on CubeCast, a new and original podcast show. Today, we're going to be talking about the role and the impactful role that nurses and especially nurse practitioners play in the ever-growing field of medicine and patient care. We'll discuss what nurse practitioners do, talk about their scope of practice, the challenges that they face, and how they can complement the current healthcare system. In addition, we'll be touching base on the exhaustive Canadian healthcare system and the challenges that it faces. My guest today is a nurse practitioner. She's got a Bachelor of Science in Nursing and a Master's of Nursing and Nurse Practitioner as a nurse practitioner. She's been in practice for over 9 years, and it's my honor to pleasure to have Courtnay Curry Wallensteen on the show tonight. Courtnay, thank you so much for coming in.
Thank you for having me.
Thank you so much. So before anything, can you tell us what a nurse practitioner is and what he or she does? And at the same time, if you can tell us all these different designations that are out there in terms of, RNs and LNPs and RNPs and what they mean.
Sure.
That would be great.
So you're right. In nursing, there are a lot of designations that nurses have, and I think that sometimes that can cause a little bit of confusion. LPNs, or licensed practical nurses, are nursing professionals that have done a diploma program that is usually 16 to 24 months in duration. And registered nurses and registered psychiatric nurses have done a 4-year bachelor program. In 2005, the BC government introduced nurse practitioners to practice, and they're advanced practice nurses that have done an additional 2 years of education to essentially become primary care providers in the province.
So you only started like 2005, right?
Yes.
Okay. So before anything, maybe tell us a little bit about your own background and how you became a nurse and what made you to become a nurse.
Yeah. So I remember in high school, we did an aptitude testing, and nursing was one of those top options that came based on some of my personality traits and interests. My dad was an advanced life support paramedic for many years, and my aunt was a nurse. So I did have some people in healthcare within my family. My dad always encouraged me towards a stable government job, and it kind of got me thinking about the path of nursing. So right out of high school, I had a scholarship to enter the health sciences, and I did my nursing degree. And then shortly after that, I was hired in general surgery and thoracics. I did telemetry, which is cardiac monitoring training to just care for some of the higher acuity patients, and did my high acuity certificate as well. And then about 3 years later, I applied for the nurse practitioner program. to do my master's.
Okay, so to go back a little bit in step in terms of becoming a nurse, just so for our audience that doesn't know, nursing is a bachelor's degree, right?
Yes, it is, yeah.
So from high school, you went to undergrad. Where did you go to school?
I went to Kwantlan.
Kwantlan, okay.
Yeah.
And so you did your Bachelor of Nursing degree and then you started working in surgery and thoracics.
Yeah.
Okay. And so what made you decide to get your master's degree to become a registered nurse? A nurse practitioner, I mean.
Yeah. So I decided that I wanted to, expand my practice, and there were a lot of special projects that I was taking an interest in at that time, and in terms of quality improvement. And I just felt this desire to care for patients in a more enhanced manner. And at that time, the nurse practitioner role was quite new in British Columbia. I'd have actually never met a nurse practitioner in person before. And so I do remember making my personal essay about why I wanted to be a nurse practitioner and really trying to find information that I could on the internet about what this role looked like. But from the information I did find, it just seemed to be a good fit for me. And I decided to apply and do my master's.
Your master's degree. So to become a nurse practitioner is a master's program. It's an extra couple of years, or how many years after your bachelor degree is it to become the nurse practitioner?
It's 2 years of full-time study.
Okay. And so do you also have to have any sort of experience working as a nurse before you can apply to become a nurse practitioner? Or can someone, for example, go straight through, get his or her bachelor's degree and then go into a nurse practitioner role?
That's a good question. So generally speaking, they recommend that a nurse is in practice for 3 to 5 years before applying for a nursing master's. This is just to ensure that they have experience, because usually after you've completed that degree, you are becoming considered more of an expert in your field. And so it doesn't make a lot of sense for nurses to be in practice for a very little amount of time before potentially teaching other nurses.
They want to make sure that they have like proper experience and have had like some patient care and all that. Yeah. So specifically, when you go and become a nurse practitioner and you have that extra level of training, how does that set you apart from a registered nurse that has a bachelor's degree specifically? So for people that don't know exactly what is the difference or hierarchical level between what a nurse practitioner is and a registered nurse, for example.
Yeah. So a registered nurse, again, has done a 4-year bachelor program. And by contrast, a nurse practitioner is considered an advanced practice nurse. So it's a nurse who has had additional experience. They've usually done a few extra certificates and extra training, or been involved with special projects, things that kind of have set their resume apart before pursuing their master's. And a nurse practitioner is classified as a primary care provider. And so
what does that mean exactly?
Yeah, a nurse or primary care provider is similar to the type of care that a family physician provides.
Yeah.
So education is done, you revisit your pathophysiology, which is the study of disease processes. You revisit in-depth pharmacology, which is the study of medications and their effects on diseases and disease processes and the body. And they learn how to safely prescribe medications. They do courses in diagnostic imaging and interpretation, and also how to perform minor procedures such as setting bones, doing suturing, inserting IUDs, and also in comprehensive physical exams. So they are trained to treat, diagnose, manage a range of conditions across the lifespan. So from infants from a few days old, young children, adolescents, adults, and geriatrics.
Okay, so when you say primary care provider, very similar to family doctors, where could patients come and see a nurse practitioner directly? just like the way you can go and see a family physician?
Yep, exactly. So a lot of nurse practitioners staff a lot of the primary and urgent care centers that are in the Lower Mainland and the province. They staff the primary care network clinics, which were a provincial initiative to kind of close the gap and meet the need for a lot of people who do not have a primary care provider. So they do provide primary care services within those settings.
Okay. And so you touched base a little bit on the scope of practice in terms of being able to have like more diagnostic powers and be able to do some specific procedures, specifically relative to what family medicine can do. And in terms of the specific procedures, can you touch base a little bit on some of your prescriptive rights and whether or not you can do things like injections, whether or not you can order diagnostic, what kind of diagnostic tests can you order, for example, imaging and that kind of stuff? Because I think that'll set us up for a little bit more discussion I want to have later on about how this can help the current healthcare system, in Canada. So maybe if you don't mind touching base on what your exact like prescriptive rights and scope of practice is.
Sure, of course. So generally speaking, depending on where you're practicing, if you're practicing in the community setting, in a clinic setting, that will kind of dictate some of the skills that you have in that setting. My background is in hospital care. So I've trained as a family practice nurse practitioner. So I've had the education I described from birth to geriatrics. But nurse practitioners, there's a lot of similarities with family physicians in the sense that they're able to treat and manage, diagnose conditions, order things like blood work, order chest x-rays, CT scans, MRIs if necessary. There are certain criteria that a patient has to meet to be able to qualify for certain tests. If you've detected a heart murmur in a patient, for instance, you're able to order an echocardiogram. And based on the findings or the reports, will determine whether or not we refer to a specialist, if we have to involve a specialist in your care.
And you can do a direct referral to a specialist?
Absolutely.
So it doesn't have to go through a family medicine doctor, family physician. You can just directly send to like a surgeon.
Exactly.
Okay.
So nurse practitioners are independent primary care providers, as are physicians.
And in terms of like injections, can you do pretty much very similar injections to what family medicine doctors can do?
Yeah. So in terms of injections, I mean, as a nurse, we give many, many, many injections. So it does make sense that nurse practitioners are also able to do the same. In terms of immunizations and following the immunization schedules, a lot of primary care providers have a tendency to defer to the public health clinics and don't do as much in-office immunizations as they used to in the past. But they can give, intramuscular injections. They should be able to, if needed or a part of their practice, connect a patient to an IV and administer IV fluids or medications that way.
Okay.
And in terms of prescriptive rights, there are a lot of things that have been added to the scope of practice of nurse practitioners over the last few years.
And is it like a growing scope of practice where you're getting more and more? Okay, so that's good. That's really great.
Our college has been really proactive about adding skills. In Canada, we have one of the most full scopes of practice of nurse practitioners in the country. So,
like as compared to like United States or maybe some European countries, you're comparing to?
Yes. So regulation is on a state-by-state basis in the United States, and so each state will kind of determine what skills are associated with NP practice. But we enjoy quite a full scope. We practice quite autonomously. There are very few limitations in what we prescribe in terms of medications. Something that was recently added is we're now allowed to prescribe anabolic steroids and amphetamines for the treatment of ADHD, which was previously a limitation. And we've also had additional rights for injecting filler and Botox. So some
so you can do some like aesthetic medicine as well.
Yeah.
So what are some of the areas that there is a difference between like a nurse practitioner and a family physician? What are your limitations currently? It seems like it's very close. Like you could pretty much do everything that you
Yeah.
do. Is it like more prescriptive rights than
I wouldn't say so much
remediations?
prescriptive. I would say that since I came into practice in 2015, that a lot of those things have slowly been eliminated and added to our scope of practice. There are lots of things that with additional training we're allowed to do, such as, providing medically assisted dying and things like that.
Oh.
And so, sorry.
But like in terms of, so say, for example, if someone wants to become a family physician versus a nurse practitioner, where is the difference, for example, in terms of like what they can do, right?
Yeah. So just like nurse practitioners, GPs perform minor procedures, which is things like setting simple bone fractures, suturing, biopsying lesions, and inserting IUDs. Nurse practitioners are limited in the sense that they're not able to take tissue samples or biopsies from the face or to suture lesions or wounds on the face. A lot of doctors were involved with obstetric care before in the past. In delivering
medicine,
babies.
Yeah. I think some still do actually
some
as well.
do.
Yeah.
They tend to be some of the older trained physicians. I would say nowadays a lot of GPs are kind of straying away from providing obstetrical care because they have to be on call, and it is an impact to their practice, their primary care practice. So they have a tendency to defer that care to obstetricians or midwives.
So it's in essence, it's your profession. It's a growing profession where you're getting more and more scopes of rights and practice scope to be able to complement the current system, right? And so be that primary care provider where people can, also refer to nurse practitioners if they don't have a family doctor or vice versa, or be, very similarly positioned so that you can provide that care that needs to be. But why do you think the nurse practitioner profession was developed in 2005 that you said? Was it the primary reason to be able to complement and take the strain off of the system, or what are your thoughts?
Yeah, a lot of people don't necessarily know what the background is for the nurse practitioner role. So the nurse practitioner role has actually been around for many, many decades, originating first in the rural United States to better serve communities that maybe didn't have primary care providers.
So direct access to like a family physician
they would enhance the scope of nurses essentially.
So it kind of organically kind of grew, right?
Exactly.
Where there was nurses but no doctors, and then let's expand the scope. And
exactly. So just with some extra training, they realized that they could meet a need. And then as that role kind of evolved and developed in the States, it came up into the eastern provinces of Canada and then kind of swept westward. And so in 2005, seeing that this was a successful, integration of a new role elsewhere in Canada, they opted to integrate NPs into the BC healthcare system, mostly with the intention of meeting the need for the lack of primary care providers.
Yeah, and I don't think a lot of people actually know about the role that nurse practitioners play, and how they are primary care providers. And do you think that there is a push from the government or the medical system where they are marketing or advertising or letting people know about it? Because I'm quite sure that if I asked 10 of my friends, probably 9 or maybe 10 out of 10 of them would not necessarily know about, nurse practitioners and having that, scope of practice.
Yeah. I think like anything, the more that the role is around and the more organic encounters that patients have with nurse practitioners. I mean, nurse practitioners are not just working in primary care settings. They work in a wide array of healthcare settings. So in the community, I know nurse practitioners that are working in heart failure. They're working in atrial fibrillation clinics. They're working in chronic pain in positive health clinics that manage patients with sexually transmitted diseases. They work in sexual health and also mental health and addictions, chronic pain. There's many, many settings that NPs work in and in the hospital setting as well. So there's a lot that they can offer.
So specifically about yourself, what do you do exactly as a nurse practitioner yourself?
My first position was in cardiac surgery. So I have a bit of a different perspective in the sense that there's 3 graduating programs in British Columbia, which is UNBC, the University of Northern British Columbia, UVic, and UBC. And all of those programs prepare nurse practitioners to work in family practice. And so whenever you work in hospital, you tend to work in specialty areas as you do in the community. And so there's a lot of additional education. You have to kind of position your mentors and resources around you to be able to provide hospital-based care. So my first position was in cardiac surgery, so an inpatient service where, as like many other surgical services, the surgeons are often indisposed and in the operating room for many hours of the day. And in live time, there's issues that crop up on the ward, like patients deteriorate, they decompensate. They, in my case, they have heart arrhythmias, or it's issues that can't be attended to when you're in the operating room. And there's also a lot of volume in surgical programs, the need to admit and discharge constantly to move patients through. And so it's really important to have a provider that exists on the ward, that is familiar with all the patient's issues, that can help expedite and identify barriers to discharge. So it serves a really important function, particularly in today's healthcare system when we're dealing with a lot of congestion issues.
Yeah, with all the challenges of wait lists and trying to get patients moving in, out from different areas. So currently, are you working right now, or?
I'm currently on maternity leave. Yes.
Yeah. So we want to come to some of the challenges that, first, nurses and nurse practitioners face, but I think later on we'll talk a little bit about some of the challenges that maybe you have faced in terms of your education and becoming a nurse practitioner. First of all, how difficult was it to become a nurse and then a nurse practitioner? Because part of the theme of this show is to not only talk about the challenge like behind the scenes of what's going on, or how long or how difficult it is, or the sacrifices you have to take on, but at the same time also be very encouraging for the next generation to say, hey, you know what, even if it is challenging, it can be done. And is it for everyone? No, but for the right person, right mindset, it can be. So how challenging was it for you when you were going through the programs?
It's a big commitment. I mean, challenging might have a negative connotation. There is a lot of commitment that is required. You have to be pretty certain that it's what you want to do. You have to be ready for a shift in your practice. For me, the rigors of bedside nursing and shift work were kind of a determining factor in me wanting to do something else. And in one sense, I thought I was exchanging some of that to have a bit more balance, a little bit more of a feeling of control over my career. But I have to say the shift from being a nurse to becoming a nurse practitioner, you take on a lot more responsibility.
And that is hard, to make some tougher decisions. And
it is. And you're not always sure it's necessarily the right thing. There's a lot of gray areas within healthcare, and you do a lot of things guided by principles. But it is a big shift to be a person receiving, ordering, acting on orders that doctors or nurse practitioners give you, and then being the one that gives those orders. So there's a certain responsibility that you need to take for those things. And, you have a tendency, I think a lot of healthcare providers are compassionate by nature. There is a tendency to take some of your work home with you. You think about things. You think about the outcome for patients and things like that.
Yeah, because I think nursing is definitely, direct access to the patient, right? And you're always at the front line. And some of the, I think, biggest challenges that in terms of like the healthcare that people face, nurses face, right? And so I think in terms of the responsibility, they play a vital role in the healthcare system. But talking about some of the challenges that you personally faced, so the 4 years that you went to school and then the 2 years, when you came out of it, what was your feeling like? Was it like, oh, this is exactly what I wanted to do? Or was it more, oh, there's so much responsibility, now what?
It is a big transition. So in nursing theory, they talk about this, transition from being a novice nurse to an expert. And I very much experienced that as a nurse practitioner. I think the nature of the environment that I worked in, there's a lot of acuity, and you want to do your job and you want to do it well, because outcomes really, really matter for those patients. So I thankfully had amazing mentors, and because I enjoy learning so much. And some of my final practicums in my degree were in cardiac care. And that's kind of when I recognized that that was where my passion was. And so I was fortunate enough because at that time there were relatively limited job opportunities available. So I have some colleagues that just kind of took what was available, what was in their area. And we've now expanded many, many, many positions across all health authorities that are available. So you kind of have your pick of job now.
Is it because there's like shortage of nurses and nurse practitioners?
There actually has been a commitment from the provincial government to fund many new seats to fill the gap that we're kind of seeing in healthcare right now. So it's really no secret that healthcare providers have left their positions in some instances. And so there are a lot of vacancies. The positive thing is that because of this influx of money and funding to create new positions and to proactively integrate particularly nurse practitioners into healthcare models, there is a lot of opportunity. So there's vacancies that exist, but it's only a matter of time as we graduate nurses who get into practice and existing nurses decide to go on to do their masters, that we fill these positions eventually.
Do you find in your experience that this is a growing trend where a lot of nurses are pursuing careers as a nurse practitioner, getting their masters and becoming more certified, having a wider scope of practice? Do you see that happening?
Yeah. Many of the nurses that I've worked with over the years, they have this constant desire to learn. So they often don't stay in one place for very long. They often do additional certificates and additional training. They'll take on projects and leadership roles. And so that's very much, I think, embedded into nursing culture, is to move on and grow within your profession. And so invariably at a certain point in time, there are a certain percentage of nurses that want to pursue their education and get their master's degree, whether or not that's the regular nursing stream, which deals with health policy. It can help you attain a position in leadership roles, administration, or to teach in universities. And then, of course, the nurse practitioner role is a clinical focus. So if your goal is to kind of get away from bedside nursing and you want to do something else, maybe pursue the nursing masters. If you know for sure that you want to continue to work closely with patients and provide primary care services for them or work in the hospital setting and still be very much involved with your patients, then that would be the way to go.
So it seems like this is a very great way to help our current system where on a daily basis, including myself, even my family, are always struggling to find family doctors. And so this seems like a very good alternative and also a complement to that system. But I'm not sure if the current healthcare system really advertising properly about this. So that's one kind of area of thought that I want to maybe hear your opinion about and what you think. And at the same time, is there like a incentive for the government to give nurses to become more certified, to become nurse practitioners, because as you said, 2 years of master's degree, full-time study, it is a big commitment going from full-time work where you're getting paid versus now I'm not getting paid, I'm going to school and then coming back out and then, okay, what are my new opportunities, right? So is there an incentive and should there be one?
Yeah, I mean, I see a lot of advertising for NP positions just because I think I'm in it and I receive a lot of those communications. And Fraser Health, particularly in my experience, is very proactive about creating NP positions. And so I would say that a lot of clinics exist in the community where patients might be expecting to get a GP, but they are attached to a nurse practitioner, and there's a lot of positive reviews and feedback that we are getting from those situations. And like
Which
I said,
is great. That's important, right?
They're also staffing a lot of the urgent primary care clinics and the primary care network clinics, which is a provincial initiative, as I mentioned. And so I think the more that people have encounters with nurse practitioners, it's kind of word of mouth. They have a positive experience. They tell their friend, I haven't been able to get a GP, but I got just as good of care from my nurse practitioner. And guess what? They're accepting patients into their practice right now. So there are a lot of patient attachment mechanisms that both doctors of BC and nurse practitioners and the province are working on to help proactively attach patients to a primary care provider. And I think that this is something that's just going to take time because we're going to need to graduate more nurse practitioners who enter practice and then fill these positions. So it's one of those work in progress sort of things.
Is there an incentive from the government to get nurses to go into these programs, or is it just on your own? So when you decided, for example, 3 years into your nursing experience to go into becoming a nurse practitioner, did you have to do it all on your own? Like fund it yourself, take time off from work, go back to school, and then come back out?
Yeah, that is an important piece when someone's considering to do their master's, because I did not find that I was able to work very much during my education. So if I did have to give some advice to somebody, I would say, particularly if you're thinking about doing the nurse practitioner stream, which is a 2-year full-time program, there's no way to do it part-time, that I would try to save about 2 years before you're thinking about getting accepted. And this will kind of float some of your expenses. There's obviously grants that are available and scholarships that you can apply for to help fund some of your education. But be prepared that you probably are not going to be able to work very much. Whereas the nursing master's degree can be taken on a 3-year basis, on a part-time basis. And so that can enable you to work a little bit more.
To kind of offset some of the costs. But for baseball, you're saying is that basically it's on you, minus the fact that there might be some incentives here or there as in terms of grants but overall it's a big decision you have to make going from full-time work and having an income and all of a sudden, I got to give that up, go to full-time school. So maybe, I don't know, in my opinion, maybe there should be some incentives for our government to invest in nurses, right? Would you agree on that?
I would agree. I'm not sure what the incentive would necessarily look like. And, a lot of nurses are incentivized almost from within. They just want to do more for their patients.
Of course. That's just the innate personality of wanting to give back and care for their patients and enhance their practice. But I think it's a big challenge. Like if I was a nurse and I was looking at that and, 4 or 5 years in, I have a life, I have an income, and you have your routines, all of a sudden I give that up, which is fine. Sometimes you have to do it. But I think given the current crisis happening in Canada, right, and the shortages of family doctors, now nurse practitioners playing a role, it's important, maybe give some incentives to these programs as well to encourage more registered nurses to
I do think it's time for some novel ideas.
I like that. So we're on the same page on that, right? So going into that, actually, maybe the Canadian healthcare system, we touched base a bit about it. It's kind of a good segue to go into it. What do you see are the biggest challenges that we have? Obviously, I think one of the biggest challenges is the extreme wait lists and, people getting in, not just to see their specialists, but even their family GPs, and now they have nurse practitioners coming. But what are some of the challenges that you currently see in our Canadian healthcare system?
Well, I've been working in healthcare for about 15 years, and so over time I've began to understand what a lot of those challenges are and what they look like, and I'm happy to speak to some of them. I think generally the Canadian healthcare system does a pretty good job. I mean, everyone always touts, free healthcare. We do pay for it indirectly with our taxes and things like that. But when you compare that with the American system and people paying enormous amounts of money out of pocket, where they have to allocate that in their monthly family budget, to have insurance coverage or forego insurance coverage. It's a big decision for some people. So in general, I think Canadians do receive high quality care when they do get care.
When they do.
Yes.
Access, right?
Exactly. And so if I had to highlight some of the main challenges, it would be congestion. It would be, the relative lack of community resources and infrastructure. It would be the long wait list for referral to specialists or to have scheduled procedures or surgeries, and of course this exodus of healthcare providers that we've seen in the last couple of years following on the heels of the pandemic.
I think that's a big one because I think we touched base on how there's a lot of a shortage of nurses actually in a lot of hospital settings.
Yeah.
Yeah.
So I mean, just back to congestion in the hospital, there's all the stories that you kind of hear about hospitals are there's such long wait times in the emerge, and it's discouraging some people from presenting to emerge. And there has been some instances of patients having poor outcomes because they avoid the emerge, or the emerge is really doing their best to try to triage patients, and in some instances have to send patients home that don't look that ill in the moment but might represent later. And this issue with emerge congestion really translates because of issues up on the ward. So patients in general are becoming more sick. They're harder to discharge. They're more socially complex. There's a lot of considerations that go into making a safe discharge. Or a patient comes in and has a hip fracture and now is not able to care for themselves within their own home. And so they rely on community resources, nursing care or assisted living facilities as a place to be able to be discharged home to. And this kind of compounds the issue. So if you are not getting throughput in the hospital, then you have the emerge congestion. And there's so much interrelatedness with a lot of the issues that exist. And in terms of wait lists, I think that we need to incentivize specialists to stay within our province because a lot of them are moving elsewhere where they might be better compensated. We need to have residents be able to match to programs within the communities that they're hoping to live and raise their families. And, the wait list did get much worse during the pandemic because people could not see their GPs or nurse practitioners in person. You were not able to perform a comprehensive physical exam on someone, and there's a certain art to detecting health conditions when you can lay your hands on somebody and not just have a virtual
direct physical exam
consult. And, during the pandemic, they were prioritizing urgent and emergent issues or surgeries only, which added to the wait lists. And so there was a lot of, catching up that had to be done during that time. And, of course, with nurses being burnt out and the staffing ratios not being ideal, a lot of them have decided that healthcare is too stressful. It's now affecting my mental health. I'm putting, my heart and soul, my energy.
Long hours, over time, right? So
at the expense of my relationships and all sorts of things. So I have seen a lot of nurses, nurse practitioners, physicians kind of move on to other things, and that's really a byproduct of emerging from the pandemic. But I do think.
I think pandemic just made things a lot worse, right?
Exactly. It compounded existing issues.
Compounded. So what do you think specifically to, maybe the role of nurse practitioners and nurses, what do you think can be done to offset this and, incentivize or, encourage more nurses to come in and, more positions to be filled and not to have so much stress on the current nurses where they're feeling mental breakdowns,
So we've been trying to chip away at the issues incrementally over the last few years. I think a big step was the nurses union being able to negotiate a new contract for their nurses that had more descriptive language in it about safe staffing ratios, about stipends for working overtime, working short, things like that. And they've also increased their pay. So before, we knew there was a problem when you could no longer incentivize your staff to come in on overtime. Overtime can be very attractive, but when you are absolutely exhausting yourself to fill staffing needs, it does lead quickly to burnout. And so I think that that's a big step. Progressing salaries with other healthcare professions, including physicians and also the nurse practitioners in relation to that new nursing contract was also a big step. And then I think the commitment from the government to create educational seats is also a very big key component. We just simply need, even if I think we're behind a few thousand nurses that we need to have working within our healthcare system.
Do you think the problem is finances, like money?
It's always about money.
It's always about money.
It's a common theme.
Yeah. So the government not be able to deliver or to make these programs because it's always constantly being challenged by finances, money.
Yeah, I think they know what needs to be done, but there's always budgetary constraints whenever we talk about issues or how to fix them in the hospital, where we raise concerns. It really does eventually come down to that common denominator, which is financing. But I do have to say that the province has committed a ton of money to major capital projects. We're seeing expansions at Burnaby General Hospital. We're seeing expansions at Lionsgate. Also seeing it at Royal Columbian Hospital with a new critical care tower. And then Surrey Hospital, even though they had a new tower created what feels like just a few years ago, they're actually getting another expansion. And then in smaller rural communities like Dawson Creek and Cowichan district, they're also getting new hospital replacements. So all of this is really essential in improving BC's infrastructure.
Well, does that mean that, like, with all these infrastructure, does that mean that more jobs and opportunities and roles for?
It is, yeah. So when they approve funding, it encompasses training staff and filling new positions as well. So I think with those things on the horizon, it does speak to the fact that the provincial government is quite committed to remedying a lot of these issues that we're seeing in healthcare. And for any nurses thinking about getting into more advanced practice and doing their master's degree, I think even though the healthcare state of healthcare might seem a little bit bleak, it actually represents, I think, the dawn of almost a new era. The slate has been wiped clean. I mean,
that's very optimistic.
Healthcare is an essential service, and so we do need to improve it. It is essential, and so it's going to take some time. But I do think it represents a lot of opportunity.
That's a very positive statement, So again, being politically correct and whatever answer you can give answer, do you see in your profession and also being like so closely involved with this, do you see that this is moving in a very positive direction and that the government is doing a proper, reasonable, good job of addressing some of these issues that you raised?
I would say so. I mean, there are always going to be growing pains, and I think that I'm seeing some of the essential components that are needed to kind of move forward. I'm excited for the opportunities that exist. And I think that the more people become acquainted with the nurse practitioner role, I think a lot of nurses are becoming inspired to kind of pursue their education to that level.
Absolutely. I think it would be huge and very detrimental to, improving this current system. And so I think one of the areas is giving an incentive to registered nurses to be able to pursue these, extra educations, because it is very difficult to, go and get extra training when there's no financial for lack of word, maybe not reward, but financial incentive, because everyone's got to live.
Even
at the
loan
end of it.
forgiveness would be appreciated, I think, by a lot of people.
Because I think just early 2023, the government changed some of the fee schedules for family physicians to be able to get more compensated, right? And so I think that's the recognition from the government saying, okay, we need more family doctors, so we have to incentivize for more doctors to go into family medicine to allow more primary care providers. So I think maybe, again, this is just my opinion, you can comment on it or not, but I think maybe this should incentivize similar actions for nurse practitioners to become more, financial incentives. There's always financial incentives that can help, right?
Yeah.
So.
That is very interesting because that is one of the main distinguishing features between a GP and a nurse practitioner is that we are salaried employees. And so GPs work within a fee-for-service model. And they also work within a blended compensation model, which they get paid based on a per-visit fee, also an hourly rate in some instances, the complexity of their patient panel, and then they're also compensated for time that's spent reviewing lab work and diagnostics and, completing paperwork and things like that. So even though nurse practitioners are engaged in all the same activities, we don't get directly reimbursed for those things.
So because you're just on a salary.
We do submit encounter codes for all of our patients. But it's really just for essentially statistical purposes for the provincial government. There's a lot of time we spent in doing that. It's every patient you see, all the main health concerns that they present with, the complexity of that visit, any procedures that you perform. So we go through that same process, but we're not remunerated for it. And so it does beg the question, are we going to remain in the future salaried employees? Do we see a shift where we're reimbursed for certain advanced practice services that we provide? Do we get compensated, to complete forms? We spend a lot of time completing forms and writing referral letters and things like that. The future is very interesting. I'm not sure if we're going to move more to a two-tiered medical system, all those sort of things.
So based on the current system, the compensation of some of the very similar procedures and tasks and reports and orders and everything that you do relative to family physicians is not proper compensation as compared to what family physicians can bill based on their fee schedule.
It's a very complex and in some ways a bit of a contentious subject because there are some nurse practitioners that are employed in the primary care network clinics, and this is a provincially funded initiative, like I said, and so those nurse practitioners are funded, are salaried, but they also have the overhead costs of running that clinic covered. And so for a GP who is billing and knows he has to see or she has to see a certain amount of patients in a day to pay themselves, pay their staff, pay their medical supplies, and cover their overhead costs, you're thinking very much in terms of a business model and how are you running that clinic as a business. And so it's an interesting discussion. There's a lot of perspectives that exist on that. And being a salaried employee, I think I just want to see that my salary is in keeping with my level of education.
And your level of responsibility.
Exactly. Yeah.
And what you do, because if you're doing everything or a lot of similar things, then that, should be compensated equally and properly.
Exactly. And I think there's a lot of nurse practitioners that work in specialty areas. A lot of them, by definition, work with very niche, very specialized populations of patients. And so if they've done extra training to provide care for those patients, and in many instances provide care that's equal to their physician counterparts, I would say that opens up an opportunity to perhaps be reimbursed through MSP for some particular, consults or procedures that are being done that way.
That makes sense. Compensation for what you do, right?
Yeah, we can envision things further. Yeah.
Well, it seems like the scope is growing and the field is growing. They're investing more and more resources and finances into it. So it just makes more sense that they would open the doors to these opportunities as well, right? You mentioned about Doctors of BC and so the government and, making these incentives and programs. Do you think that there's a lot of doctors that are on board with nurse practitioners?
You had to ask me a difficult question.
Yeah, because of I think that's something that comes up a lot. I have a lot of doctor friends or nurse friends as well, and then the subject sometimes comes up. So I wanted to see what your thoughts are on what you think doctors think of nurse practitioners and whether or not they accept nurse practitioners taking on some of their roles.
Yeah, I would say particularly now that the nurse practitioner role has been around in 2005 and people are understanding the role a bit more, I think there's many physicians that are accepting nurse practitioners as very complementary to the healthcare system and fulfilling specific needs. Nurse practitioners are taking on lots of patients in niche areas of care that are very medically complex. And sometimes there is a reluctance to care for those patients because the appointment times are much more involved. The history taking is more involved. The manage of chronic conditions is much more involved. And so nurse practitioners have no financial incentives for taking on those complex patients. So somebody needs to see them. And I think we're doing a great job seeing those patients. I think we're very welcome in surgical services where, as I mentioned, the surgeons are in the operating room for many hours of the day. And it enhances the care of their patients to have a nurse practitioner and somebody kind of on the ground dealing with issues. I think it's a very desirable role to have also from an administrative perspective. You want to see throughput through these programs. We need to enhance patient attachment, whether that's with a GP or a nurse practitioner. And so I think everyone accepts that we all have a role to play within healthcare. I think the only time where any discussions sort of come up that I've heard about is this compensation. If
that's like the biggest topic that kind of comes up
with covering overheads. It does seem almost that would be the main thing I would say.
The reason I asked that question specifically is because I think historically some of the stigmas or the taboos that come with, the role that nurses play is that sometimes they report or they say or that it might be thought in, this cultural society where they're not getting as much recognition as doctors in terms of the care that they provide to the patients, even though they probably provide 90% of the care, right? Majority of the, let's not put a number on it, but majority of the bedside care and the one-on-one stuff. And so do you think that stigma and taboo still persists in your profession, and also whether it's getting better with doctors recognizing and, people recognizing the role that nurses play and nurse practitioners play?
Yeah, that's also a very great question. I think within the roots of nursing, that's very much embedded in nurses having an accessory role to physicians, and that's been embedded for over a century in the hierarchy of nursing care. I think where that began to change is we began to see more males enter nursing practice. And they provide an amazing shift in the dynamic of the healthcare team, working with all women versus having a bit of a mix of personalities and things like that. It was kind of one of the first shifts that I saw. And of course, when you have these advanced roles and being able to pursue your education further, I think it opens up a lot of doors for people. And, within healthcare, the hierarchy does exist. You do feel it at times, but I think that there's a lot of mutual respect when you're able to work alongside different healthcare professionals, allied health, physicians, specialists, surgeons, nurse practitioners, nurses. You have a respect for what everyone else can provide and offer in a collaborative environment. And all of it is necessary for providing good, care, holistic care to patients. And so
some of those barriers are definitely being broken, as you're saying, and like there's more collaborative work, and some of the stereotypes are being broken. With more, for example, one of the top stereotypes is that most nurses are females, right? Which has been probably for the past 100 years, but in the past, maybe a few years, there's been more males going into a nursing profession, which is great, right? We need to see.
Yep. Nursing is a very humanistic profession, and it's not just reserved for females as caregivers, as mothers, or anything like that. I think that there's a lot of skills and interpersonal skills, communication, just caring, just having a better, more in-depth understanding of the human body and health. All of those things can only be positive when you bring that into your personal life as well.
That's right. So in terms of your own profession and the positives and the negatives, I want to ask you some questions about what are the most, top positive things and the gratifications that you get from your profession, and then also some of the maybe stressful moments. And I'm sure there's a lot of stressful moments that comes with it, right?
I think the main thing for nurse practitioners, and just being trained from a primary care perspective to care for families, you get a lot of satisfaction from giving people capacity, for giving people agency to make their own decisions regarding healthcare. I mean, essential and key to that is having primary care providers to begin with. But it's rewarding to be able to diagnose a condition, to see it through and treat it with medications or refer to a specialist and see that patient have their issue remedied. I think there's a lot of satisfaction in that. And, working in cardiac surgery, they call primary care more preventative or upstream approach. You got to catch the issue before it develops. And in the hospital care, you tend to be down the stream a little bit. Patients already have issues and things like that. I have to say, working in cardiac surgery, we do lots of teaching with patients after they have their coronary arteries bypassed or their valve replaced. You put them on appropriate medications, and you do lifestyle teaching with them. And patients very much have felt that they've gotten a new lease on life. You've given them another 5, 10, 20 years of life. And so working with a patient population that is so grateful for the care that they've received, I think is very, very rewarding. And then also the feeling of being a part of a team. There's really something indescribable about being a part of a good team, a well-oiled machine that works well together. You're all working for this common goal in the best interests of the patient. So I have to say, for me, that's probably one of the most rewarding things, is to feel like you are a part of something.
Part of something and giving back and being such a important piece of the puzzle, right? What about stressful moments?
For me, just with the patient population that you work with, there is a level of acuity. They've had a big operation on their heart. They have chest tubes. They have arrhythmias that they go into. They require a lot of medications. You have issues with heart rate, blood pressure, fluid balance, preserving kidney function, controlling high blood sugars following surgery, things like that. And there are some complications that can occur in a small percentage of patients. And so it's being prepared to deal with those things and handle those things, knowing who your resources are, who you can call in a moment to come be there to support you to take the best care of that patient. So it would be the acuity, the emergencies, the unforeseen things, and just the systems pressure that you sometimes experience. Like, we need this discharge now. Well, we can't get them home safely without X, Y, and Z. So yeah, some of the political things as well.
Yeah, that's stuff. Yeah. So speaking of stress, and I know, in healthcare, it's a very common theme. As you get obviously more experience, you learn how to deal with it better. But very common theme for, stress to come home a little bit and, affect your life. How do you cope with some of this craziness that you just described and you see and you come home? How do you take care of yourself and how do you stay healthy and balanced?
Yeah, that's easier said than done. I think we kind of know what we need to maintain our well-being, but it's putting it into practice, making it a habit. So getting good sleep, keeping hydrated throughout the day. If you're able to get out for a walk and not just stay for the duration of your shift in artificial light, which has to have some impact, right? Unfortunately, when you're a nurse, there's no way around 12-hour shifts and working day shifts and night shifts, which can be really hard on your body's rhythms, right? Exercising. I mean, you need to let out some energy sometimes. So I think we know...
Seeing your chiropractor, right?
Exactly. Maintaining things in alignment. So I think we know what those things are, particularly as healthcare providers. We know what those things are. And, taking care of your own mental health when you literally give all of your energy, your emotional energy, anything extra that you have, you are giving to the care of your patients. And over time, that invariably will take away a little bit of something for yourself. So I think it's just recognizing those things and making a plan. How do I get out in nature? How do I maintain my social life? How do I maintain my relationships?
Because all of those aspects need work you have to work on them.
We are literally no good caring for other people if we can't take care of ourselves.
That's right. It's a very powerful statement. That's very important, actually. You got to be healthy, take care of yourself, not just physically, but mentally, emotionally, your relationships, everything, right? It's a lot of effort to be able to handle a high-stress job, which is gratifying, but it does come with a lot of stress. And, and you need a good balance. One question that I want to touch base with you, and I asked this with some of my female practitioners, is that the challenges that females face in terms of, or maybe extra challenges in terms of wanting to have families and kids, and particularly, any sort of higher level education where, it takes years for you to you get that certification and get the training, but then you want to have kids as well. So in your experience, how has that been and how challenging is it? And what is your advice to the future, the girls and future ladies that want to pursue high level careers? To be inspiring, right?
Yeah. It's definitely not easy I think, as you know, a lot of women are having children later, and it usually is because they are pursuing careers and they're getting well established in their careers. Sometimes it's taking them a little longer to find that right person and settle down and have children. And, for me, it was challenging being well established in my career. Being in my mid-30s before I got married and had my first child, and the impact just on your energy and things like that. But I think you just need to recognize it's a chapter in your life. You will get through it. It's going to be very busy balancing all of your duties and responsibilities, but you will get through it. Having a supportive network of people in your life is really, really essential to being able to support your ability to be a working professional, but also come home and be present with your children. So striking the balance is not easy. It does take work, and you need to kind of recognize where you can do better, but it's all doable.
So take on the challenge. You can do everything, and no need to be afraid of not being able to pursue high-level careers and still be able to have a family and have kids.
Yeah.
Which, you're a prime great example of, of being a champion of it. So I think my last question, a good segue to go is that you kind of touch base on the advice for next generation, but would you encourage more and more people to go into the nursing profession and specifically the nurse practitioner profession? And what advice do you have to the next generation of nurses and nurse practitioners to be?
Mm-hmm. I mean, I might be a little biased just because I enjoy clinical care so much, but I think that what should really be active in your considerations is, can you commit yourself to full-time versus part-time studies? Do you want to get away from bedside nursing and get into a more leadership or administrative role, deal with health policy, work on a systems level, be involved with the education of nurses, the next generation of nurses? Or do you want to still be involved with patients? Maybe you don't want to do shift work and do days and nights, but you're working clinic hours and still involved with patient care and kind of that enjoyment that you get from piecing together the whole clinical picture and things like that. So I think you need to know what your end goal is. You need to know, do you have the support to go back to school?
Yeah, it's important.
What family life looks like? Can you budget for things? Can you be prepared to take time off of work or balance your studies and also work a little bit along the way? That would be the main thing that I would get people to really ask themselves and to save for it and just be as prepared as you can. Connect with people who have done those programs and ask them a ton of questions. What was your experience? How did you manage this? How much did it cost you? But because I see such a lack of primary care providers in the province, that's where maybe some of my bias comes in, is that healthcare is an essential right. We see so many problems in healthcare that are essentially a direct result of somebody not having their care followed longitudinally, And so, and there's patterns like genetic things that are seen within families. And so it almost feels like long gone are the days where you had a care provider that took care of your mom and your, and your sisters and your brothers and your grandma. So I think that we need to just replace those vacancies, essentially. And we need to build up the system again, and we need to have appropriate ratios for primary care providers to patients. And we need to have people fill those vacancies in the hospital because it's all related. And I think that over the next decade, we should see some major improvements as long as our projections and infrastructure keep up with the growing demand and the pace of the community.
Good. So highly positive. Come and become a nurse practitioner. I know you love your job, but I want to thank you for being part of this show and sharing all your insights. Thank you so much.
Thank you so much.
Cheers. Thank you.